It's another promising morning for Victoria today, with the second lowest number of new cases in months, but also a day tinged with sadness because yet more people have died. Reporter Steph Ferrier joins us now from Melbourne. Steph, g'day. So take us through this latest information that's just come through in the past half hour or so.
Hi Joe, yes, so we have another 55 new cases of coronavirus detected in the past 24 hours. That is slightly up on yesterday's number, which was the lowest since June the 26th of 41, so another 14 cases there. But the good sign is that that trajectory is still continuing down. Our 14-day average now is 84. It was around 84.8 yesterday, so it is remaining steady. Just on the 7-day average figures, we're now down to 74 new cases over the past 7 days, compared with 104 a week prior to that. So that does show that we are on the right path. Sadly, as you mentioned, another 8 deaths. We're obviously going to get breakdowns of whether or not they occurred yesterday or prior to that, with these changes in federal government reporting regulations from aged care sectors, and just also how many of those relate to aged care. But that does increase our state's toll from coronavirus to 683. At least those new cases, as I said, do show that we are going slowly down to hit that benchmark that we are required of fewer than 50 new cases in order to move to the next stage post this extra 2-week lockdown. And we do have obviously some promising signs from yesterday. We're still to get some of these updated figures, of course, that will come out in the press conference with Daniel Andrews at some stage later. But yesterday we had just 1,780 cases that are active across Victoria, and only importantly, an extra 4 cases in community transmission. So hopefully those community transmission numbers will remain low as well.
And Steph, there's this ongoing disagreement between the federal and Victorian governments over the effectiveness of Victoria's contact tracing system. Where's that at?
Yeah, so the health authorities here and the Premier Daniel Andrews have been quick to jump to defend our contact tracing system after it copped a bit of criticism from the federal government, as well as some experts who say that it simply hasn't been up to the job. Now, Scott Morrison and this nation's former Chief Medical Officer, Professor Brendan Murphy, both put up New South Wales as the gold standard. They say that that state has a very decentralised system with a lot of networks embedded within the local health districts, which does help to get on top of contact tracing very quickly. And in fact, the Health Minister, Greg Hunt, this morning said that Victoria especially needs to be more transparent.
What has to be done is each case every day, not just with an initial contact, but to work to have all of the contacts of the positive case identified and reached, to be able to make sure that the data is published daily, that the sites where the cases have been identified are released publicly, as New South Wales does, in terms of whether it's a public transport route, whether it's a restaurant, whether it's a gymnasium, whether it's a shopping centre.
And so the Premier, Daniel Andrews, was quick in his defence. He says that we are getting to most cases within 24 hours, and in fact 100% of close contacts of those positive cases within 48 hours, which is aligning with the national benchmarks. He does, of course, say that there's always room for improvement, so they are looking at artificial intelligence to help enhance this contact tracing system. And he's also hinted at yet another rescue package for hard-hit businesses that are really doing it tough after consultations with industry sectors, especially those businesses that are going to have to stay closed until at least late October and possibly even beyond as a result of this very stringent roadmap we have here. That, of course, all depends on those numbers coming down, as I mentioned, so at least we are on the right track. But Scott Morrison says that with these really tough thresholds, even Sydney would be in lockdown, and of course it isn't at the moment. Greg Hunt has even referred to or likened it to Wuhan, saying that even in Wuhan in China, we didn't have as long lockdowns as we are facing in Melbourne here. But the Premier says that Sydney is a completely different situation.
Sydney's not had the amount of community transmission that we've had, so I don't think that's a particularly valid comparison and not a particularly worthwhile one. We're not in New South Wales. We've got a set of unique circumstances that apply to Victoria and a roadmap to safely and steadily ease out of these current rules, these current restrictions, to find a COVID normal, to open up and to stay open.
He says the fact that we have gone down from 725 to well under, 41 and then 55 in the past couple of days shows that this strategy is working. Brett Sutton has given us a glimmer of hope as well. He says not so much this extra 2-week lockdown, that's set in stone, but the second step after that, October 26, if we manage to get to 5 new cases or fewer, then there is the possibility that businesses and kids going back to school might happen earlier than that date. So that's some hope for us here.
And Sept, breaches at the hotel quarantine set up there in Victoria have been identified as the source of this second wave that hit Victoria, and there's an inquiry happening into that setup. What's happening with that inquiry today?
So today we're expected to hear from outside sources which are going to look at the outside implementation of this outbreak investigation and management and incident review. So that includes people from Alfred Health as well as doctors and experts from the Department of Health giving evidence. We also heard that documents that were tendered to Victoria's hotel quarantine inquiry show that a former police officer had warned and raised security concerns about breaches within the quarantine system just a couple of weeks in. Apparently an off-duty officer had seen some guests wandering close to a convenience store during supposed fresh air breaks, as well as one of them even walking around with a takeaway coffee. So there were concerns flagged, and the Victoria Police chiefs did actually hold meetings with some of these security firms to discuss their concerns just a couple of weeks into it. Of course, as you mentioned, we did see epidemiologically that 99% of the active cases now in Victoria can be linked back to this bungled scheme.
Okay, reporter Steph Ferrier there in Melbourne. Now, more than 100 staff at 2 Sydney hospitals are in isolation after healthcare workers tested positive to COVID-19. Reporter Kathleen Ferguson joined us now from Sydney. Kathleen, g'day. So what can you tell us about these healthcare workers in isolation?
Good morning. So that's right. The Chief Health Officer here in New South Wales, Dr Kerry Chant, said that well over 100 people were impacted by the healthcare workers who had tested positive at these hospitals. So this follows the announcement of the 4 new cases in New South Wales in the last 24-hour reporting period in New South Wales. So 3 of those were healthcare workers. 1 worked at Concord while potentially infectious, and the 2 others worked at the Liverpool Emergency Department. And this follows a previously reported case who also worked at both of those hospitals while infectious, but interestingly was wearing full PPE gear for all patient interactions and wearing a mask otherwise. So New South Wales Health is investigating that, but all staff who were working at the time of these positive cases have now gone into isolation and are being tested. Dr Kerry Chant is expected to update us on those figures, if those healthcare workers are all going to remain in isolation for 14 days or not, as that contact tracing continues.
Yeah, and so is this cluster expected to grow?
So again, the New South Wales government said that it's hoping that its contact tracing, as Steph Ferrier was saying, has been described as the gold standard. They're hoping that being quick on that will mean that it won't grow, that they're on top of it, but we'll just have to wait and see.
Okay, Kathleen Ferguson reporting there from Sydney.